Hello, I'm Justin Gallagher, Associate Publisher of the American Journal of Managed Care. Welcome to This Week in Managed Care from the Managed Markets News Network. This week, the Pharmaceutical Research and Manufacturers of America, better known as PhRMA, named Stephen Ubel as its next CEO. He will replace John Castellani, who had previously announced plans to retire at the end of the year. Ubel, a veteran Washington lobbyist, comes from AdvaMed, which represents medical device makers. He steps in at a time when drug makers are under fire for rising prices and some presidential candidates are unveiling plans to control the cost of drugs. He is credited with improving relations between FDA and device makers and has lobbied for repeal of the 2.3% medical device excise tax. High-cost patients who suffer from opioid abuse have some things in common, according to a study published this week in the Journal of Managed Care and Specialty Pharmacy. Claims data show these patients have higher rates of chronic conditions and mental health problems, and were also more likely to be female and older compared with lower-cost patients. The average healthcare cost for high-cost patients was about $89,000, compared with $11,600 for a low-cost patient. Not only were these patients more likely to end up in the hospital, but they had longer stays, according to the study. Researchers said the study shows the need for doctors to take a complete medical history and psychosocial history before prescribing opioids, especially for patients in Medicaid. Keeping track of patients' behavioral health, and especially how it affects their diabetes or cardiovascular health, is important to improving the overall health of patients in Medicaid. That's the bottom line of a long list of recommendations from the National Quality Forum made recently to the Department of Health and Human Services as part of an annual effort to update a list of measurements designed to improve health and control costs in the Medicaid program. The NQF recommendations are consistent with recent discussions at major professional meetings in the field of psychiatry, which are recognizing how depression and major disorders affect physical health. Medications to control psychosis may even cause diabetes or cardiovascular conditions. And with many mentally ill patients enrolled in Medicaid, these health effects need careful tracking, according to the NQF. HHS Secretary Sylvia Matthews-Burwell this week awarded $685 million to 39 healthcare networks that are striving to improve quality of care and patient access to information. The Transforming Clinical Practice Initiative, which is part of the Affordable Care Act, is designed to help doctors at the individual practice level with things like communicating with patients through email, offering real-time alerts about high-risk patients, offering better mental health screening, and giving better warning about substance abuse incidents across multiple care settings. Professional societies will also receive funds to update practice guidelines and teach members to use new ways of communicating with patients, as well as alternate payment models. In a recent interview with AJMC, Mark Boutin, CEO of the National Health Council, said patient communication is a vastly underused tool.
Patients are being dramatically underutilized. We're spending very little time now in our system actually asking them about what's going on in their lives, because the delivery of care is much more than just simply providing for their clinical outcomes. It's really assessing what's happening in their lives, what are they capable of doing, what are they willing to do, and then aligning care around that. We're also spending very little time really asking a patient what's important to them. In the days of the community doc, they were there when you were born, they were with you for decades, they knew everything that was going on in your life, they had a relationship with you. Everything in the system makes it virtually impossible for us to have a relationship with our providers. We don't go in, we don't tell them what's important to us, they don't have the time to ask, and they simply provide care that may or may not be aligned with what's important to us or what we're capable of doing.
The American Journal of Managed Care will be covering what's new in alternate payment models this week when we visit the annual summit on value-based insurance design at the University of Michigan, hosted by our co-editor-in-chief, Dr. Mark Fendrick. Look for our coverage later this week at ajmc.com. For everyone at the Managed Markets News Network, I'm Justin Gallagher. Thanks for joining us.